And we have this breaking news late this afternoon. Italy shut its borders to try to contain the coronavirus. And good evening, I'm Monique Minglavin.
I'm Steve Rabel. In the last 90 minutes, President Trump said he will ask Congress to consider a payroll tax cut to help the slumping economy. Now here's a look at the latest numbers. According to the state, there are now 22 deaths, 20 in King County, 1 in Snohomish, and 1 in Grant counties. There are 162 confirmed cases in the state, the majority, 116, in King County.
Now we have team coverage of the coronavirus emergency, beginning with Cairo 7's Allison Grandy. She is live now in Kirkland. Allison?
Monique, tonight we know that one of the firefighters who transported a patient here from the Life Care Center has tested positive for coronavirus. We've also been told that no employees who work here have been tested. And as far as patients who were cared for here, 19 of them have died from coronavirus. We watched another patient we're told had symptoms of coronavirus rushed away in an aid car. Of the 20 coronavirus deaths in King County, 19 are associated with Life Care Center of Kirkland.
It's been horrible, but even though she tested positive, she's smiling. She's doing okay.
Today, Bridget Parkhill and her sister Carmen Gray visited with their mom through the window. 76-year-old Susan Haley tested positive for coronavirus last night.
We've been assured that that is the case. They've stepped up monitoring to every hour and a half.
35 total test results. That means we have about 20, approximately 20 residents left to receive results on. But the results are as follows. Of the 35, we have 31 positive.
With the Life Care Center of Kirkland, where Allison is. Let's listen into their latest information.
And we have 3 inconclusive results. So again, that's 35 total tests. 31 of our residents in those tests have tested positive for the coronavirus. 3 are inconclusive, meaning they have to do further testing, and 1 result is negative. I'll take questions. These are residents inside the facility at this point. No. These are all test results of current residents within the facility.
Can you expand on the inconclusive test? What they have to do next? What do you know about it?
All I know is that they need to do further testing. So I don't know if that means they do a new test or they can use the swabs and the kit that they already have to do that as well.
And how many people then are not tested inside?
It's approximately 20 that we're still waiting on results.
So everybody's been tested,
Every resident has been tested within the facility.
And how about the workers?
We still have not tested the employees within the facility. We have received word that it's possible that they will be doing testing of employees off-site, but that hasn't been finalized yet.
Did they tell you what this means for you going forward?
So according to the word we have received from King County Health primarily, and I believe that they're in consultation with other agencies, is that our residents who have tested positive will remain on site. We will not be immediately transferring them to hospitals or other locations. The facility has already been working on a contingency plan. We have a smaller wing of the facility in which we'll be moving those who test negative into that space, and that work is ongoing. We have been calling families. In part, we delayed this a couple hours so that we could get as many of those family phone calls done prior to making this announcement this afternoon, and most of those phone calls have been made.
Is they offer any insight into, any insight as to why so many have tested positive? Have they learned anything new?
No, there's, other than sharing of direct information, there's no further information they've given us.
Why won't they be hospitalized? Why are they remaining?
As we understand, as soon as they show symptoms, as we've been treating all patients, once symptoms hit a level of acute where we feel we can no longer treat them, then we will transfer them to hospitals. But they haven't given us, we don't have an exact reason why. Our understanding, though, is that it's about space within hospitals and other constraining factors that exist in other facilities.
But it's not just symptoms. I mean, they have to be pretty severe before you move them out to a hospital, right?
Correct. Those symptoms have to reach a level of acuteness that our nursing staff feels that they would be better treated outside of here.
Any luck since 1 o'clock with trying to get tests or getting more information about testing?
What we're hearing now is it's potential that they will be doing off-site testing of our employees, but that has not been finalized.
With so many people testing positive inside, what precautions are keeping the employees from taking the virus outside of the facility?
As I said earlier, the employees are all trained in infectious disease. They all wear personal protection equipment. So they are following their same training in guidance with other guidelines that we've received from the CDC.
It just doesn't seem, just kind of having seen some people outside, it doesn't seem like they're wearing the same level of protective gear that I've seen in other videos.
Some people you're seeing are administrative, and so they may be in less protective gear just in the immediate lobby there. So in part, that's what you're seeing.
So it is accurate to say that hospitals don't have enough room potentially for all of these residents?
I can't speak definitively for those hospitals, but that's our understanding, is that until they are to a level of acute symptoms that they need that hospital space, they've asked us to keep these residents in place.
Were you able to get any clarification on the discrepancy between the numbers that you had here earlier of people who had passed and the King County
No.
information that 19 of the people who passed?
Frankly, our focus has been on receiving these test results and working with contingency plans and communicating with family members.
Will the inconclusive tests, will those patients be tested again?
I'm unaware of exactly what is.
So the news conference is still underway right over here. Here's what we know. They say they have been able to get back the results of 35 tests of patients who are here at Life Care Center of Kirkland. Of those tests, 31 came back positive. That's not too surprising when it comes to what we've been hearing from relatives of patients here. They were told if their loved one is inside there and has been cared for by workers and been around in that environment for the last week or two, that it's likely they could have the virus. Now, it's interesting. We asked this afternoon about whether or not employees here have been tested, and the same man who was just speaking, Tim Killian, said they have not been able to get those tests. But then a nurse who's working up here today from Puyallup, who works for Life Care in Puyallup, says they are testing employees who work down there. So we're asking a lot of questions here, still trying to get answers. We're going to go back to doing that right now and check back with you later on in this newscast. Live in Kirkland, Allison Grandy, Cairo 7 News.
Allison, before you go, we know you've been reaching out to these families involved in this crisis right now. What is their number one concern, and are you feeling like their questions and concerns are being addressed?
Of course, their number one concern is the care of their loved one. And we've been talking with the family of Susan Haley for almost about a week now. And you would think that they would want her just to get out of there as soon as possible, but they can't take these people home because many of them need higher levels of care, and they're not sure there's a place in a hospital that can take them now that they've tested positive. So you would think you just want to get your loved one out and take them home, but because of the care they need, that's not possible. With this new announcement about 31 positive tests, he said they're going to portion off part of this care center and put those patients there. But they've already told us for the last 10 days that they have been quarantining people to their rooms, isolating them in different sections already. So it's hard to understand exactly what's happening inside here.
Allison, what positive news could you glean from what the spokesperson said today? What positive news for families can we deliver to them now?
Steve, they've wanted their loved ones tested. They want to know. And while the care of that patient may not change, just knowing that they've tested positive for coronavirus gives them an idea of what symptoms to look for, what could be next. It also lets that loved one know if they might have been in contact with that patient in the window where they could have become contaminated, so they might need to go get tested as well. They've wanted answers. This is the first wave of getting some of those answers. There's just over 50 patients left here, so if they have results positive on 31, and I wasn't sure because this was all happening at the same time exactly what the results were for those other 4. They're just going to start getting these results back in batches. Keep in mind, on Saturday, they didn't even have enough tests here to test all of the patients. They had 45 tests and about 62 patients. Later that day, they got more tests. Now they've done all of the tests, and the results are going to start coming back in batches. But keep in mind, as these family members are finding out their loved one is tested positive, they want to make sure someone is keeping a very close eye on that patient. And with the strike team here from the feds, we're told there are doctors inside here in these rooms actually going every hour or two to take vitals, to double check fevers, to make sure that people don't go downhill so quickly that they can't get to the hospital to get that vital care.
All right, Allison. Well, thanks for breaking it down for us. All I can say is I don't know that I've seen much more heart-wrenching than family members looking through windows, talking on cell phones because they can't actually see their loved one.
Yeah, and we can clarify also, Allison, I think probably as you were setting up for that live shot, of the 35 tests, they did say the 31 were positive, 1 is negative, and 3 is still outstanding. Right. So we will get that information. We know you're going to go back to work as well. All right, we'll hear from you again probably in a little bit, Allison. Thanks so much. Now, the University of Washington is rapidly expanding its ability to test people. A drive-through testing site is up and running at UW Medical in North Seattle, and that can test 40 to 50 people per day. Now, the testing is available to students and employees now, but plans to expand later this week. KIRO 7's Dee Sun shows us the test facility.
A patient showing coronavirus symptoms pulls up into their vehicle right over here. They go up to this medical team, and that patient gets both of their nasal cavities swabbed. That swab goes into a test solution before it's put into the fridge, and the patient can be on their way. The whole cycle only takes a couple of minutes.
We need widespread testing, and right now
the University of Washington is working rapidly to meet the demand for coronavirus tests.
There's urgency around it.
It's launched this drive-through test site at one of the parking garages at the UW Medical Center Northwest campus.
Inside this tent is where we keep our supplies.
Right now, it's only available for UW employees and students.
And what we've learned from viruses like SARS and other coronaviruses is that they can really rapidly disseminate through a hospital and cripple a healthcare workforce. And we're trying to stay ahead of it and prevent that from happening.
People showing symptoms book an appointment, then meet medical staff wearing full protective gear who are ready with test kits.
This is what the swab looks like. It's a flexible plastic swab that just goes into the back of the nose.
A patient allowed us to see the process. It all happens through the car window. After the swab,
put it in, break it off, put it in the biohazard bag, and then send it to the lab.
After each test, staff changes into a completely new set of personal protective equipment, from gowns to gloves to masks, and cleans their hands
to make sure that they're not contaminating themselves.
The whole thing is so quick, patients can be scheduled every 10 minutes. It looks very similar to the drive-through testing South Korea is doing at a much higher volume, but UW is expanding too, as soon as later this week.
We're looking into really rapidly scaling this up.
It plans to open another clinic, likely near Harborview Medical Center or south of the city, and open testing to first responders, employees at long-term care facilities, and any UW medicine patient showing symptoms.
We are only going to get on top of this outbreak if we know who is affected and able to, quarantine people rapidly.
UW Medicine is also working with the Seattle Flu Study as well as the Gates Foundation to develop an at-home COVID-19 test kit you can do right in the comfort of your house. Now, the concern is there's going to be some differences from medical professionals swabbing versus you swabbing yourself, and so that whole process is still being examined. Live at the UW Northwest campus, Dee Sun, KIRO 7 News.
Tonight, we're learning the president may have been exposed to the virus himself. 2 Republican congressmen who recently interacted with the president are now under self-quarantine. Representatives Matt Gaetz and Doug Collins say they were exposed to coronavirus at the Conservative Political Action Conference last month. Collins shook hands with the president on Friday, and Gaetz flew aboard Air Force One today. Senator Ted Cruz is also isolating himself over a possible exposure.
Well, major Seattle businesses, including Amazon, Microsoft, Starbucks, and Alaska Airlines, they are helping those hit hardest economically by the virus. The companies are working with Seattle right now to build this COVID-19 response fund. It's going to be $2.5 million in donations to make rapid response grants, and those will be applied to people without insurance, also people who have no access to sick pay, also people in healthcare and gig economy workers, and communities of color.
Well, panic at today's closing bell. The markets plunged 2,000 points, signaling a possible recession. It is the worst fall since the financial crisis of 2008, but there could be a silver lining. KIRO 7's Deborah Horn is live at a Seattle gas station. And Debbie, you might not want to look at your 401k right now, but experts say take a look at gas prices instead.
And look, Steve, at how much they might drop. After all, oil prices are dropping too. That could mean cheaper gas at the gas pump. But some are asking, at what cost? The bloodbath on Wall Street began as soon as the markets opened for what could be a very long week. The market fell so far, so fast, trading was halted for 15 minutes.
To slow the market down when it's moving very quickly in either direction, either up or down, so that investors have an opportunity to take a step back, understand what's going on, and react.
Even in unusually quiet downtown Seattle, the sinking market is being felt.
It's like nothing we've seen in over a decade. We've seen other financial crises in our lifetime. You know, after 9/11, 2008, similar. This is it's a crisis right now.
What do you think about it?
I think that it's going to be bad for someone like me who works in retail. If people don't have their money to spend, then it's going to hit me.
Right now, the best thing to do is, first of all, take a deep breath and relax, which is hard to do.
Seattle investment advisor Julie Bach says we shouldn't panic.
Remember that as an investor, you're long-term. All investors are long-term investors.
Moreover, a major cause of today's stock market drop is falling oil prices, something that could ultimately be good for consumers.
And that could mean cheaper gas.
It could be, but I'd rather have a better economy than cheaper gas.
So even that silver lining might not work for just about everybody, but experts are telling us that everyone has one really important thing on our side: time. They believe the market will eventually come back, but they say if you have a portfolio, don't look at it. You probably won't like what you see, at least in the short term. Reporting live in Seattle, Deborah Horn, KIRO 7 News.